Welcome to Vitality VIP's Wellness Elite channel. Let's start.
Hi, I'm Dr. Mary who supports natural healing methods. In today's very short segment, I would like to share one critically important piece of information with all individuals who suffer from diabetes. Dear listeners, let's get straight to the point. Most individuals treating type 2 diabetes use a first-line drug called Metformin, which lowers blood glucose levels. However, it's not without a negative impact on our body, as it often causes a deficiency in one vitamin. We must remember that taking this drug is associated with a decrease in vitamin B12 levels in our blood. It turns out that up to 30% of people taking this medication may have a deficiency of this vitamin. Furthermore, trying to supplement it in our body may not work if we don't add an important ingredient to this vitamin, which I will talk about shortly. Therefore, individuals with diabetes are often unknowingly at risk of complications from deficiencies in this vitamin, which we must remember can be irreversible in states of prolonged deficiency. So, what complications can arise in case of prolonged vitamin B12 deficiency? Well, if we are exposed to a deficiency in this vitamin for a long time, it can lead to peripheral nerve damage, erectile dysfunction, degeneration of the spinal cord, urinary incontinence, or anal incontinence, memory loss, paranoia, or even paralysis. So, what should we do to effectively supplement our body with this vitamin in case of diagnosed deficiencies? Well, during vitamin supplementation, we must simultaneously administer calcium, whether from our diet or supplements. I would like to first show scientific evidence. In a study from 2000, the title reads, "Increased calcium intake reverses the poor absorption of vitamin B12 caused by metformin." In the text, we read that patients receiving metformin have reduced absorption of vitamin B12 and low serum levels of vitamin B12 due to calcium-dependent antagonism of the ileum, which is reversible with calcium supplementation. Therefore, to reverse disturbed absorption of vitamin B12 due to the use of metformin in type 2 diabetes, calcium and vitamin B12 should be taken concurrently, as specified by the study, for at least 3 months. As for the amount of calcium and vitamin B12 to supplement in case of deficiencies, smaller doses of vitamin B12, around 10 micrograms, taken 2 to 3 times a day for 3 months, are recommended over large or mega doses. The amount of calcium to take depends on an individual's diet, but around 700 milligrams of calcium should be an optimal dose for the first 3 months, followed by 400 milligrams of calcium and around 10 micrograms of vitamin B12 daily to prevent further deficiency. A trustworthy dietitian or diabetologist can assess the precise calcium requirement based on an individual's diet to provide more accurate calculations. The current norm for vitamin B12 level in the blood is considered deficient if it is below 200 pictograms per milliliter. The threshold values are between 200 to 400 pictograms per milliliter, while everything above 400 pictograms per milliliter is considered normal. I recommend maintaining a concentration of this vitamin within the range of 500 pictograms per milliliter. If you know someone who suffers from type 2 diabetes, be sure to pass on this information. It may save someone's health. Thank you for your attention. Don't forget to subscribe for more and see you in next video.